So today we'll talk a little bit, and we only have 30 minutes for this, so I'll go through this fairly quickly. And I'm sure this is also okay for you because you already are familiar with the patient safety component. So by the end of the session, you will be able to describe the reporting requirements for the nurse staffing hours indicator, access the monthly survey for reporting. We'll talk a little bit about manual and CSV upload, both options. We'll go briefly over that, what that looks like for you guys. And then you will be able to identify some analysis options that are available in NHSN for this component or for this method. A little bit of background. So nurse staffing. The nurse workforce is the nation's largest healthcare profession. We also know that registered nurses are that part of the workforce is the largest segment of the workforce in healthcare. The number of jobs, this is from you see the link here on the slide from a report that is accessible to you. RNs are nearly 4.7 million, LPNs and LVNs, almost 658,000, and then nursing assistants and orderlies, about 1.5 million, a little under 1.5 million. So it's a large part of healthcare, and there are a lot of discussions about this, right? There were a lot of discussions about this workforce before the pandemic. Certainly there was a spotlight on it during the pandemic, and that continues as it should be. So we developed this nurse staffing hour indicator in NHSN in collaboration with the American Nurses Association and representatives of the American Association for Critical Care Nurses and Press Ganey, as we were aiming to provide a mechanism for acute care hospitals to report nurse staffing data from their critical care units. So for right now, it's limited to critical care units. We know that or most hospitals have these data already available in their facilities. And this indicator is based on Press Ganey's National Database of Nursing Quality Indicators, or NDNQI. So you'll see here the NQF indicators of skills mix and nurse hours per patient day. And some of you are familiar with that. You also may know that we have conducted a limited pilot in 2023 where 30 facilities voluntarily entered data into NHSN using our definitions. And I wanted to thank those 30 facilities to help us work through some of the kinks and really figure out how this will look like in NHSN. So thank you to those 30 facilities that were participating, and thank you for the collaboration with these entities. So let's go a little bit over the definitions of some of the data points that would be reported. Nursing staff, we talked about registered nurses, LPNs, LVNs, and unlicensed assistive personnel. We'll talk a little bit about the definitions a little bit closer. I wanted to point out that this includes staff employed by the facility and temporary staff that may be coming into your facility through contracts or agencies. So registered nurses are licensed RNs assigned to that critical care unit where you are get direct patient care hours as well. And they are part of the actual staffing for that day where you count patient care hours. So you want to include nurses that are assigned to that unit, that are actually working on that unit, and not nurses that are calling out and that you didn't replace. You want the actual work hours that are charged to that critical care unit cost center. You want to exclude any APRNs that may be working specifically with a licensed provider. You want to exclude nurses that have primarily responsibilities in administrative areas, and you want to exclude specialty teams or patient educators and nurses that are assigned to some areas that don't really include patient care. LPNs or LVNs, also same thing, assigned to critical care unit where you are collecting those directed patient care hours as well. Again, these need to be nurses assigned to that unit, actually working on that unit. So if they call out, you don't want to include them unless you, replace them with another nurse. You want to exclude, again, administrative duties. So if they are primarily working in an administrative area or with administrative duties, you want to exclude them from your patient day count. And I'm sorry, not patient day count, from your nurse hour counts. And if they're part of a specialty team, that sort of rotates and is not really part of that unit specifically, you want to exclude them. And then unlicensed assistive personnel are individuals that are trained to function in an assistive role to nurses in the provision of patient care. And they are delegated by or under the supervision of a registered nurse. So think about that, how that would work on your unit, on your critical care units, who you would include and who you might exclude here. So unlicensed assistive personnel are often used for activities of daily living, bathing, feeding, dressing, transfers, vital signs. You want to exclude unit secretaries, clerks, schedulers, monitor technicians, anybody that is really not included in the daily activities of the unit that is related to patient care. So if you have a unlicensed assistive personnel that is pulled to transport for the day, for example, you want to not include them in your daily count. So what is considered direct patient care? It's patient-focused activities that nursing staff is performing on that particular unit. And you want to, we know that nurses have a lot of different type of duties. And sometimes you may start out the day in administrative role and you may be getting pulled into direct patient care. So for those situations, you want to consider to count a nurse in those hours for direct patient care if their responsibilities for the shift were greater than 50% of their assigned shift in direct patient care. So direct patient care, what is included in that? So a big part of that is admission, transfer, discharges, right? Your day looks completely different when there are a lot of admissions, transfers, and discharges than if you just go along with the 20 patients in the unit, right? And you see some other examples here: care coordination, documentation time, anything that's related to direct patient care that is patient-focused is included. What you want to exclude is budgeted or scheduled hours that are not actually worked. Somebody is calling in sick and you don't replace that nurse for that shift. You don't want to count that in your actual nurse hours count. Orientation and education time and committee times would be excluded. And again, What you want to count in your patient care hours is both employees and contract staff for each one of the categories that we reviewed. So what do we consider a critical care unit? As you're reporting to NHSN, you have already mapped your units in NHSN, meaning you use the definitions we have for different units for NHSN reporting purposes, and you have identified those units in NHSN as critical care units. So you have the location type that includes that CC for a critical care unit. So again, if you're already reporting CLABSIs, CAUDIs, etc., you have already identified that in NHSN. The total patient days. So you want to use the total number of patients in the unit per day during the calendar month. So on the count is usually done on the same at the same time each day, and you already are conducting that count if you're already reporting in NHSN. That's already reported in summary data. So we're using the same methodology. And if you're already reporting that in summary data, it will auto-populate on nurse hours in that section where you report nurse hours, and I will go over that in a second. So it does not count every patient that has been in the unit for the day. So most of the time, most facilities use a midnight census. And if that's what you do, you may not have those patients that have been discharged or that were readmitted to your units. You just take the count at the time where you count the patients present in your unit. And again, that is already in your summary data when you report your denominator into NHSN. So it's the same count. So what are the reporting requirements? I know we talk about requirements here, but I wanted to point out that this is voluntary reporting. So in order to report these data, you must be enrolled in NHSN. And again, if you're here today listening to this presentation, you're already enrolled in NHSN, or likely you are. The critical care units must be mapped in NHSN, identified in NHSN, and again, if you're already reporting into the patient safety component, that's already completed. We encourage you to report your data at the end of the month for the previous month on an ongoing basis. But if you're just getting started and you would like to enter data retrospectively, you can enter data as far back as January of 2023. And we encourage you to report for all critical care units that you have in your facility. It's not necessary that you could just pick one or two, but we would encourage you to report for all critical care units. Okay, so what's the reporting process? This is the NHSN landing page. That's what it looks like for you. So there's a blurred out area where your information would show up. You click on patient safety to select the component, and then you select your facility or your group. And then again, summary data, that's what the summary data screen looks like. I'm not going to go into details here. That's really something that you likely already completing. But this is where you can enter summary data. So on the left menu, you see summary data. And then when you click on that, you can enter your location code, the month and the year, and enter your patient days and other denominator data. So for reporting nurse hours, again, on that menu on the left in your patient safety component, you'll see surveys and then navigate to monthly. And when you click on that, a screen that looks similar to this will pop up. Your facility will auto-populate because remember you selected that as you were entering into the patient safety component. Then you select your month and year. And if you already entered summary data, the patient days, it will auto-populate on this screen. And then you can just click on the appropriate tile. So in this case, it's highlighted for RN hours and for the ICU2. You click on that and it allows you to enter your data manually. And then obviously you click Save. We also have CSV upload available for you, both for facilities and for group upload. Facility data can override group data, but group data cannot override facility data. And that's as it should be. You know, if there's updated data that facility can enter, we certainly want to allow that. CSV data will not override patient days entered in summary denominator data. So we encourage summary data again to be uploaded first before you enter nurse staffing data. It will make life easier for you. The forms for CSV upload, as of this morning, we're not quite on the website yet, but it should be there any day now. This is what the template looks like, pretty self-explanatory. For CSV upload, there's a separate section in NHSN that gives you a lot of information about that. If you've never done CSV upload and you want to get more information about it. So for CSV upload, you'll see on in the monthly survey, as you click in there, you can import or select import monthly survey for nursing hours. And when you do that, you can also do that for a group. So if you selected group when you first entered the patient safety component, you can do group upload. And when you do that, again, you select month and year, and then choose a file, and then you click submit. Alrighty, and then analysis options. Just really quickly, you already know this, but when you want to run reports, before you do that, please generate your data sets. And the way you do that is go to the analysis section. So on the menu of your screen, you find analysis, and then select generate data set. While data sets are generating, you can do other things in NHSN and then come back to this to run reports. And to run reports, you click analysis and reports, and this screen will come up, and you will select what report you want to run and modify. So you can run analysis by facility, by location code or location type. And we also have rate tables available for you. So numerators and denominators. So numerator would be the nurse staff hours, right? So you have total nursing staff hours. So that's the sum of all RNs, LPNs, and UAPs for that particular unit, or just RN hours for a particular unit, or LPN, LVN hours. Again, this direct patient care for that particular unit, and then UAP hours for a particular unit. And the denominators is our total patient day count. So that midnight census, summing it up per month, and then it's a monthly count. And again, this is unit specific when you enter it, and you can run it unit specific as you run your reports. So the different metrics, you have all nurse staff hours per patient day. So that takes the productive hours by all nursing staff and divide them with the total number of patient days that you entered. And a similar um, um, way is available for RNs, LPNs, and UAPs. So you can just run it by RNs and the total number of patient days, or LPNs, total number of patient days, or UAPs. And you can also run a percentage of total productive hours worked by RNs, LPNs, or UAPs. All right, this was a quick run through. I was trying to stay on time. Here are some resources for you. That screenshot on the top right is identifying where you would find those resources when you look for it on the patient safety component resource page. You can always use the service desk portal. You can still use nhsn@cdc.gov to send us questions. You can include annual training into the subject line. And we love getting questions from you guys. We love being in contact with you. And we really hope that you consider reporting to NHSN and that this will be a meaningful component for you. I'm going to